Welcome, everyone. My name is Hiba Osman. I'm a palliative care physician and assistant professor at Harvard Medical School. And I'm thrilled to welcome Dr. Rothchild to this webinar. Alice Rothchild is a physician colleague who got her MD from Boston University, and she completed her residency in OBGYN at Beth Israel in the 1970s. She is native to Boston and has done a lot of community and advocacy work in the Boston area. Soon after graduation, she founded a nonprofit NJP for women and children's health. And she was on faculty at Harvard Medical School until the end of 2013, when she retired from clinical medicine and shifted her focus exclusively to her writing and advocacy work. She is a filmmaker and a writer, and she's actually in Boston on a book tour. She writes children's books as well, but all with an advocacy lens. And we took this opportunity of her visit in Boston to have her come and speak to us about a topic that's very close to her heart. Alice has been working in the Middle East since the 1990s. She is a member of JVP and JVP Health. She's a member of Gaza Mental Health Program or a board member. She's a member of Just World Education and We Are Not Numbers. She's been going to Palestine since the early 2000s and has been to Gaza 4 times, most recently last August. She has been speaking on health and human rights issues since she began going to the Middle East, and she's going to be sharing her experience with us today. Thank you so much, Dr. Rothchild, for joining us. I just want to let the participants know that this session is being recorded, and you will have the option to ask questions in the Q&A. Please start putting the questions in as they come up, and we will leave time to Dr. Rothchild at the end.
Great. So let me just share my screen. So it's really wonderful to be here. And let me shrink some of the things that are in my way here. So I'm going to be focusing on updating people on the impact of the war on Gaza and the particular impact on maternal and newborn health. And I need to get my computer to advance, which of course it's not doing right now. So I've been to Gaza, as was mentioned, 4 times since 2005, working with NGOs with a focus on health and human rights. And I've been doing direct services. I've run women's empowerment workshops and a lot of interviewing and documentation. And Hiba already mentioned the kind of organizations that I work with. So if we look at an analysis that was done by the London School of Tropical Hygiene and Tropical Medicine in November of last year, after the war had been going on for about a month. They did a public health analysis, and they noted that there were multiple typologies: an armed conflict, forced displacement, slow onset of food insecurity, a near complete blockade of humanitarian and other supply chains, as well as a high number at that point of injuries and casualties, including medical workers, as well as the collapse of facilities and healthcare service components. So they made some predictions. They said, if looking at nutrition, if this lasts a month, there will be insufficient dietary diversity, as well as high anemia levels, and a low baseline for acute malnutrition. If it lasts for 2 months more, they note increasing malnutrition with a burden on infant malnutrition because of the disruption in feeding and care practices. If this should go on for 3 to 6 months, they predicted increased acute malnutrition and infections, as well as epidemics of micronutrient deficiencies and rising levels of anemia. And so the war is now in its 7th month. When they looked at reproductive, maternal, and neonatal outcomes, again, at 1 month, they said there's going to be an increase in risk factors for poor outcome, partly due to stress and inadequately clean birth facilities, as well as the fact that many of the births would not be managed and there would be no care provider for neonatal emergencies. If this went on for 2 months, they it predicted worsening maternal nutrition, reduced access to antenatal care and family planning. At 3 to 6 months, they predicted worse birth outcomes, and their list included stillbirths, early neonatal and maternal deaths. And this would be because of the lack of antenatal care, skilled birth attendants, as well as inadequate maternal nutrition and an increase in the number of unwanted pregnancies. And they noted that there will be other issues as well. There will be a burden of endemic infectious disease, the fecal oral and airborne route. And this will largely be due to the level of overcrowding and the fact that there is insufficient hygiene. And there's a term WASH, which refers to water, sanitation, and hygiene. And this would all be disrupted by a war, as well as the disruption of access to treatment and diseases being worse due to malnutrition, as well as a disruption in vaccination programs. They noted that there would be disruptions in medications for chronic disease, such as insulin supplies, as well as increasing pulmonary disease due to the dust and all the military weaponry detritus in the air, rising levels of cancer untreated, faster progression of pulmonary and kidney disease and cardiovascular disease due to the lack of treatment and the stress level. And then on top of that, there would be war-related injuries and worsening mental health. And their list included anxiety, depression, suicide, and gender-based violence. And this would all be occurring in the context of rising levels of poverty. So by 3 to 6 months, this public health analysis predicted large numbers of women and children with severe malnutrition, epidemics of micronutrient deficiencies. With neonates and infants, they thought there would be a rapid deterioration in their nutrition, not only from maternal stress, but poor breastfeeding. As you can imagine, a malnourished, dehydrated mother will not be able to breastfeed, and then inadequate hygiene. And if this woman is able to find formula, she has to mix it with water, which will be largely contaminated. And they said that before all of this happened, the preventive and reproductive maternal and neonatal health was what was described as relatively okay. So almost half of women used contraception, which was primarily IUDs. Almost all of them had more than 4 prenatal visits. Most of them had a postnatal check. And there was about a 10% high-risk pregnancy rate, mostly with diabetes and hypertension. The C-section rate was 22%. Interestingly, maternal deaths were more in the third world direction, with sepsis, hemorrhage, and pulmonary embolism being the primary factors. And they predicted that all of these factors would deteriorate. So what this is telling us is that healthcare and healing occur in a socio-political context. So when we look at Gaza, healthcare is provided in the context of a siege, checkpoints, closures, curfews, a strict permitting system that restricts medications, equipment, patients going in or out, the separation wall, perimeter fence that's militarized, multiple Israeli incursions, massive assaults, frequent detentions, as well as factional violence. And I think there's some ethical questions we have to consider regarding health in this setting. We need to think about international law, collective civilian punishment, what happens with severe restrictions of access and the ghettoization of a population, with incarceration, especially of children, and the proportionality in war. And as I've said, healthcare and healing occur in a socio-political context. So we need to be looking for political solutions to these issues. And we have to ask, why is life expectancy in Israel 10 years more than in the West Bank and Gaza? Why is maternal mortality 9 to 10 times greater in the territories than in Israel? Now, I want to first mention the issue of Israeli apartheid and war crimes. In 2021, a number of human rights organizations stated that the behavior of the Israeli military and government towards the Palestinians in the territories was consistent with apartheid. And this is a quote from B'Tselem, which is a human rights organization in Israel. And they said, "A regime that uses laws, practices, and organized violence to establish and maintain the supremacy of one group over another is an apartheid regime." And I saw this in terms of the COVID epidemic or pandemic. When COVID hit, I started curating a weekly update on Israel and the territories and the status of COVID. And what I noted was that with the Oslo Accords, the Palestinian Authority was set up a healthcare system and to manage it. But the Geneva Accords predated the Oslo Accords, and that mandate said that occupying powers are responsible for combating contagious diseases and epidemics in the territories. So what I saw was that Israel wanted the Palestinians in the territories to have the responsibilities of sovereignty, meaning they were supposed to provide the healthcare, without the benefits of sovereignty, meaning the resources and control over the system. So your response to the pandemic totally depended on your geographic, ethnic, and political status. And so medical apartheid doesn't happen by accident. And I'm going to read the stuff on the left because it's the take-home message. More than 75 years of Israeli domination and dispossession has affected Palestinian life through occupation, siege, annexation, de-development, and permanent displacement of refugees, severely impacting the ability of Palestinians to access the essential building blocks of health. And this fragmentation of society and destruction of the ability and opportunity to create essential institutions involved in healthcare has created a reality that is recognized today as medical apartheid. Two separate systems with two separate realities. And we see this in the disparities in life expectancy and maternal and infant mortality. Now, the way this happens is through an Israeli policy of de-development of the healthcare system, of not allowing equipment and critical medication in, not allowing doctors and nurses to leave the strip and get high-level education. It happens through strict permitting. So if a patient needs high-level care, they have to go through bureaucratic hoops to get a permit, which is not easy to do, and they don't always get it. And then they have to have a permit for the next thing and the next thing, and it severely impacts healthcare. And so there's this chronic lack of medications and equipment and highly trained personnel. There were direct attacks on facilities, and this is all happening in a conflict, high levels of conflict-related trauma. I also just want to mention that I think there might be an impact of Zionism on medicine. So in 2018, the nation-state bill was passed by the Knesset in Israel, the parliament, and this officially privileged Jewish citizens of Israel over Palestinian citizens. So there is a form of institutional racism that is present in Israel. So the question we have to ask is, are Jewish Israeli clinicians able to see Palestinian citizens of Israel or Palestinians living in the West Bank or Gaza as fellow human beings? And I would point out that in November, 100 Israeli doctors wrote a letter approving the bombing of Gaza hospitals. So I'm going to talk about healthcare in its broadest sense, and this is a definition that was created by Physicians for Human Rights Israel. So we're looking at health requiring freedom of movement and access, and then the building blocks of a healthy society: clean water, sanitation, nutrition, housing, adequate education, employment, and the ability to live in a nonviolent world. And the picture on the left is from the Palestinian Medical Relief Society, and along with pamphlets when you're pregnant of, take your vitamins and breastfeed your baby, you get something that says what to do if you're stuck in labor at a checkpoint. So I keep mentioning international law, and I want to just run through this. So international humanitarian law was codified in the 4 Geneva Conventions of 1949, which were designed to protect civilians in times of war and treat as war crimes the murder of civilians, torture, rape, and hostage taking. So this is all part of international law. It governs the relations between different states. There have been additional protocols relating to the protection of victims, as well as other agreements that do things like prohibit the use of certain weaponry or military tactics. And then in 2000, we have the protocol to the Convention on the Rights of the Child on the involvement of children in armed conflict. So if we look at healthcare in Palestine, in The Lancet, it has been described as fragmented and incoherent. We have several different kinds of institutions. We have the Ministry of Health, which was established in 1994 after the Oslo Accords. They were predated by UNRWA, which is the United Nations Relief and Works Agency, which was set up in 1950 to attend to the needs of the refugees created in the 1948 war. And there are 8 very overcrowded refugee camps in Gaza, 23 in the West Bank, and then a scattering in Jordan, Syria, and Lebanon. Then we have a host of non-governmental organizations, such as Palestinian Medical Relief Society. We have private providers, and overlaying this is the role of the Israeli government in de-development. If you are a Palestinian living in East Jerusalem or in Israel as defined by the Armistice Line in 1948, you have access to 5 first world HMOs as well as private physicians. Now, I just want to go through some of the facts of occupation because this impacts healthcare. Gaza was occupied by Egypt after the 48 war. Then the Israelis took over in 67. They encouraged Jewish settlers to move in. And then in 2005, the Israeli settlers were withdrawn unilaterally. The following year, Hamas won a legislative election. This was an election that was certified as democratic by Jimmy Carter. And then the following year, there was a civil war between Hamas and Fatah. And Fatah was partly funded by the US. Hamas won. And the Israelis, as well as the US, really clamped down and created this very severe siege. Since then, there have been multiple assaults, 2008, 2012, 2014, 2021, 2022, and then the one that has started in October. In addition, between 2018 and 2019, there were weekly nonviolent protest marches, the Great March of Return to the perimeter fence. And these marches were met with Israeli snipers and created a huge amount of orthopedic injuries. The picture on the right is something I took in 2014 to remind myself to tell you that I put it there because the things that we're talking about are not new. So back in 2014, we have a horse-drawn cart delivering canisters of fuel so that people can have adequate levels of electricity at night. Now, there are some tremendous challenges for women in Gaza. Some of these are socioeconomic. There's an urban and rural divide. So urban women have much more opportunity than rural women and have a very different setting. There's a tendency towards early marriage and having large families. And the women are responsible for these children. It is a fairly conservative, there are conservative attitudes in terms of the roles for women and LGBTQI. There's a tremendous stigma around having mental health or getting mental health care. And before the war, there was about a 50% poverty rate. There is the issue of gender-based violence, and I've interviewed a number of women regarding this issue. And the story I kept hearing was, my husband was picked up by the Israeli soldiers, taken to prison, came back, 5 years later, destroyed man, couldn't work, was unable to find employment, was totally humiliated, emasculated. His children didn't recognize him, and he took his rage out on his wife. It's a fairly classic situation. There's also racism within the society. If you look at Gazans, there are blonde, blue-eyed Gazans, and there are people who look as if they come from Africa, which they historically do. And so the darker you are in Gaza, the less value you have as a woman. And women are highly educated, but there are few roles for women in terms of finding employment. So they suffer from occupation and siege, from a huge amount of loss and trauma. There's a tremendous range in health provider skills due to the lack of ongoing training. There are issues around access and funding, and there's a tremendous lack of screening, particularly diagnostic and therapeutic options, very few mammograms, limited cancer treatment, and they have to obtain permits for high-level care, especially cancer care. Women also have tremendous strengths. They are the main cohesive force within the family. Connections and support. They are famous for their samud, which is perseverance. And as I said, they're highly educated, and they take great pride in their cooking and a kind of joy and love of life that I'm always struck by when I visit Gaza. So just looking at Gaza to get everybody oriented, in case you're not, this country of Israel is right here in the left upper quadrant. This kidney bean shape is the West Bank, and this little black line is the Gaza Strip. Egypt is to the south, Jordan is to the east, and then we have Syria. Border crossing in the north is Erez. That's where people like me go in and out. The border crossing in the south is Rafah. This is the border crossing with Egypt, and that's where Palestinians go in and out. And you will hear a lot about Kerem Shalom, which is a border crossing with Israel right in the south here. Gaza is tiny. It's about 28 miles long and 6 miles wide. And if you took the entire Gaza Strip and put it on the state of Massachusetts, you can see how tiny it is. Now, before the aggression, when we look at the number of medical institutions, there were 13 governmental hospitals, and there were 142 primary healthcare centers run by the Ministry of Health. UNRWA for the refugees and various NGOs. There were a bunch of private hospitals. There were 2 medical schools. And then there were many nursing schools and professional schools. But there's a real disconnect between the number of professionals available and the jobs available. So it's estimated that there were 120 nursing positions open each year and 5,000 nursing students. There were less than 20 psychiatrists in Gaza, and less than 7 were physicians. So there were multiple health issues before October. One of them was the lack of regular electricity, sort of averaging 4 to 8 hours a day at various times. So the hospitals really relied on generators. And if there were fuel shortages, hospitals had to close. I mentioned all the restrictions on permits and medicine and equipment. There's a tremendous lack of specialists because doctors can't get outside of the strip for training. The medical personnel are exhausted, and frequently their salaries are unpaid. And the COVID-19 pandemic really stretched people very thin. I want to talk about UNRWA and the funding for UNRWA. Because UNRWA is responsible for the healthcare for refugees. So funding was slashed by Trump. It was partially restored by Biden. After this, they were threatening to cease operations because they didn't have adequate budgets. And then in January 26th, the Israeli government accused UNRWA of having 12 employees that participated in the horrific Hamas attack. At that point, without any further investigation or validation or evidence, 20 countries suspended all funding. Several countries have resumed, as you can see, and several countries never stopped the funding. We have to ask, though, is there a real serious campaign to destroy UNRWA, which is a goal of the Israeli government? So in our own Congress, there were about 8 bills filed to eliminate UNRWA and to stop the U.S. giving aid to any countries that funded UNRWA. In Israel, the Land Authority attempted to vacate a vocational training center and charge a massive usage fee. They've tried to evict UNRWA from its headquarters of 75 years in East Jerusalem, but that headquarters has now closed after an arson attack about 2 weeks ago. They've been restricting visas for international staff, revoking tax exemption, suspending shipment of goods, blocking their bank accounts, and refusing access to their local staff to Jerusalem. In January 31st, Netanyahu stated that UNRWA was, quote, in the service of Hamas, which is blatantly untrue, and many Israeli officials called for donors to cease funding. If UNRWA closes, this will undermine the education, health, and other services essential to the human rights and continued existence of Palestinian refugees created in 1948 and 1967. So at the end of March, our U.S. Congress voted to bar UNRWA funding through March of 2025, which is a devastating blow. They cut funding to the UN Human Rights Council unless it's certified that it was taking, quote, significant steps to remove Israel as a permanent agenda item. They banned funding of the UN Commission of Inquiry on Israel, and they voted to limit aid to the Palestinian Authority if the authority initiated or supported investigations in the International Criminal Court, which is the highest court in the planet, if they're investigating Israeli crimes against Palestinians. And in the midst of this, there are 2.3 million Gazans, and half of them are under 18. So what is happening? There has been, over the course of the war, a total disintegration of the healthcare system. The latest numbers that I've seen is that 35,500 people have been killed. Half of them are women and children. That's an estimate of 2 mothers per hour. There have been almost 80,000 people injured, with 75% of them female. And when I use the female, it's not that the men are guilty and the females are innocent, but we know that the women are innocent. The number killed in Israel during the Hamas attack was 1,162. In terms of Israeli soldiers killed in Gaza, it's at 282, and injured 1,745, with 128 hostages. Now, if you look at the pattern of Israeli airstrikes, the bombing occurs on people's homes, civilian gatherings, markets, houses of worship, bakeries, restaurants, banks, ATMs, hospitals, healthcare facilities, ambulances. There's been a full electricity blackout and restrictions on fuel. And of the Gaza hospitals, 15 of them, of the 36, are partially and very partially functioning. And people tend to shelter in the hospitals, so they are massively overcrowded. Now, I just want to say something about hospitals and international law. According to the Geneva Conventions of 1929, Article 19, medical establishments and their staff and the patients have protected status and should not be attacked. The bar for hospitals to lose this protected status is very high. They have to be documented as committing acts harmful to the enemy. And experts pretty much agree that these conditions have not been met for any of the 36 hospitals that have been damaged or destroyed by the Israeli military. And it's also true that the military is required to protect patients and staff. So as of now, I'm looking at the numbers, which are pretty devastating. It looks like there have been deliberate Israeli attacks on healthcare, around 755 human rights. Start my video. I don't have a video. There have been 755 human rights aid personnel and medical personnel who've been killed, and many others arrested and detained. About 130 ambulances destroyed, almost 200 UN staff killed. So about 2/3 of the hospitals and UNRWA centers are unable to function. Their clinicians have been reporting major unusual burns on the dead and the wounded, raising the question of whether white phosphorus is being used by the Israeli military, which is forbidden in urban areas. And there are currently 8 field hospitals that have been set up that are functioning. When we look at more numbers, about 60% of the housing units have been destroyed or damaged. 75% of the population is internally displaced in pretty horrific conditions. There are severe shortages of water, medicine, widespread hunger rising to the level of famine and starvation, particularly in northern Gaza. It's now estimated that since January in northern Gaza, the average caloric intake has been 245 calories a day. I have a colleague who's a psychiatrist who was fled to the south with his family, and he just got out, and he's a skinny guy, and he lost 30 pounds during the course of the war. There are increasing intracommunal tensions, as well as gender-based violence. There are some 50 to 60,000 pregnant women. And it's estimated that about 63 women are killed daily. There are 17,000 Palestinian children who are orphaned. And there's a new diagnostic category where a child or a baby is pulled out of the rubble and is the only living survivor. And this is a child without living relatives, often with no one around to identify who they are. There has also been major damage to half the cropland and tree cover, 1/5 of the greenhouses, almost 500 agricultural wells, most of the agri-food infrastructure. Much of the livestock has been killed or slaughtered prematurely. So this tremendously impacts the food sources. The soil and groundwater are contaminated with munitions and toxins. The air is polluted by smoke and particulate matter. The water was pretty contaminated before, and it's even more contaminated now. So that in terms of pre-October water levels being produced, it's about 20%, and most of the sewage pumping stations are not operational. And there are now 270,000 tons of accumulated waste. All the wastewater treatment plants have shut down. So this means that raw sewage is being continuously pumped into the Mediterranean Sea, where people are bathing, are washing their clothes, or sometimes drinking the water. This got much worse in the winter because there was severe flooding and there was raw sewage in some of the streets of the cities. Given this horrific hygiene situation, there has been a spike in chickenpox, scabies, lice, diarrhea, respiratory illnesses, hepatitis A. There is also estimated more than 10,000 cancer patients that are no longer receiving treatment, and 350,000 with chronic disease who are having no medications, and there's almost no dialysis available. So this obviously has a huge amount of impact on mental health, and women and children are particularly vulnerable, and children are have been noted to develop convulsions from fear, rising levels of bedwetting. And I should just say that Palestinian children have a chronic problem with bedwetting because they are chronically stressed, and it's much worse. They're finding children with increasing levels of fear and aggressive behavior, increased nervousness, and also a refusal to leave their parents' sides. And UNICEF has now said that Gaza is the most dangerous place in the world to be a child, and they estimate that more than 1 million children need mental health and psychosocial support. The other really harrowing thing is that the mental health providers are suffering from the same levels of stress and exhaustion as their patients. They have also fled. They also don't have food. They also don't have water. They also have lost family members. All of this is happening in the entire population. The other thing is that if patients are very sick, they request medical evacuation through Rafah, and only 46% of such patients have been approved, and only 38% have been actually evacuated, although right now no one is being evacuated. So as of now, or recently, more than half of Gaza's 2.3 million people were sheltering in the south in Rafah, and this is what it looks like, in tents, rickety shelters, living in rubble. There is a desperate need for food, shelter, water, and medicine. Netanyahu ordered an evacuation of civilians and said there would be a safe zone, but there is nowhere safe in Gaza, and people are very fearful of an impending massacre. And just looking at humanitarian aid, I mentioned the Rafah crossing in the south and Kerem Shalom, which is the southern crossing with Israel. There are hundreds and hundreds of trucks lined up waiting to get in. They intermittently get in, but these crossings have been pretty much closed since May 7th, when the troops came in and took over the Rafah crossing. But much of the aid had been suspended after the killing of the World Central Kitchen staff. There are airdrops and ships coming in with food, but this is highly inadequate and inefficient. There's also a telecom blackout intermittently, which makes it very difficult for people to communicate when they deliver emergency aid. And I should also add that the Israeli forces have destroyed or damaged all the libraries, archives, museums, and universities. So people are talking about a sociocide, which also has a mental health component. There have been most recently escalated attacks in Rafah, and the latest numbers are that 800,000 of the people that fled to Rafah have now fled outside of Rafah. Some of these people have been displaced 3, 4, 5, 6 times, and everyone is worried about a large-scale military assault. The head of UNICEF said that a ground operation in Rafah, quote, would bring catastrophe on top of catastrophe, and he highlighted the unimaginable toll. He talked about the toll on children. He estimated that there are 600,000 children crammed into Rafah, nearly all being, quote, either injured, sick, malnourished, traumatized, or living with disabilities. And this is just a map. This is southern Gaza here in eastern Rafah, and people are fleeing towards the sea. Al-Mawazi was described as a humanitarian zone. The picture on the bottom is Al-Mawazi in February, before people started fleeing there, and you can see that in no way is there any space left, and there's also no more facilities for anything. So people are also fleeing to Khan Yunis and Deir al-Balah. In the north, there are about 600,000 people that have little to no access to healthcare. There's also more unexploded missiles and bombs that have fallen in Gaza than anywhere in the world since World War II. The humanitarian aid trucks are being blocked by Israeli protesters. This started on January 25th, and the protesters do things like set the trucks on fire and dump all the food on the ground. And since the troops seized Rafah, there is no aid getting in. And meanwhile, Palestinian armed groups are continuing their indiscriminate rocket fire.
Alice, you're breaking up.
So I'm in someone's house and I don't have anything else I can do. Can you hear me now?
Yes, better.
Okay. So I'm talking about Al-Shifa Hospital. So there were bombardments before November 15th, and the surgery department was hit, the coronary care division, a warehouse, the maternity floor was hit, and an outpatient clinic. Then in mid-November, the Israeli troops and tanks entered and took control of several sections. They searched and interrogated people. They went into nephrology, internal medicine, stormed those departments. They detonated a medicine storehouse. I gotta advance this. There were about 7,000 people sheltering. It had been up to 40,000, but people had fled, hearing what was about to happen. And at 9 a.m., everyone in the hospital was ordered to leave in 1 hour, which was impossible, and there were no ambulances for transport. So there was a great state of panic and fear. Many people left on foot. They left pushing gurneys and patients in wheelchairs. And the patients who couldn't leave were left with a handful of medical staff. The Israeli troops ordered all young men in the hospital to surrender. They took captive dozens of people, some of them relatives, some of them displaced people sheltering, some of them patients. Many Palestinian men were interrogated while being held naked and blindfolded. Some were taken away. And Israel accused Hamas of placing a command center below Al-Shifa Hospital, and the hospital officials denied this claim. And I should say, I have a number of colleagues that I know that have worked in Al-Shifa Hospital who completely denied that they found any evidence of Hamas in the hospital. The New York Times was able to enter, and they found the evidence they saw was unconvincing for a command center. So patients died. This is a famous picture of babies that were in the NICU, and then there was no electricity, so the incubators weren't working. So they put them all together, hoping they would huddle together and keep each other warm. The hospital barely was functional. And then in February, it got a resupply of fuel. It started functioning better. And then on March 18th, there was a massive Israeli attack. At that point, there were 30,000 people sheltering at the hospital. And this attack ended on March 31st. Now, I just want to note that Ehud Barak, the former prime minister, on an interview on CNN, stated several months earlier that Israeli engineers built the tunnels under Al-Shifa in the 1980s to increase the hospital capacity. He said it's a high-risk area. We did this to lots of hospitals. We did this for hospitals in Israel. This is how hospitals are in high-risk areas. Hamas and hospital staff continue to deny this. Eyewitnesses talk about bodies everywhere, bodies with tanks rolling over them, massive destruction, dead children, unarmed civilians. Okay, did the recording get started again? Okay. And patients died because of the lack of power, oxygen, water, and medications. And many companions were arrested, some were executed, and many were displaced.
Alice, we can't see your slides anymore.
My slide. Okay, I guess I have to reshare it.
Come over into this room.
Oh, 1 second. I'm being invited to a different room. Don't anyone go away. 1 sec. I think I'm getting closer to my internet. 1 second. I'm so sorry. Where do I plug in mine?
No, just,
I want to plug my computer in.
oh, yeah. Okay.
You can plug it in when I
I'll
talk.
do it.
Can you hear me now?
Yes.
Can you see my slide? Can you see my slide?
No.
No. Okay. Let me figure out how to stop sharing. Oh dear.
Slide is different.
I'm going to forget the slides. I'm going to share for you, although I don't remember which slide you were on. So
I'm on the picture of Al-Shifa Hospital.
this one? Can you see my slides?
I can't see your slide because my slide is up. I just don't know how to make my slide. Okay. We will figure this out 1 second. So it's a picture of the destruction in Al-Shifa Hospital.
Yes.
So why don't I see what I can do to get my PowerPoint up in a way that I can see it. Okay. So the next slide is about the 8 mass graves at the hospitals. So on May 6th, there was a report of a total of 8 mass graves found at 3 hospitals. They found more than 520 bodies. The aid workers said it felt like pulling my heart out of the earth. What happens is when bodies are found, then Gazans flock to the hospitals looking for their missing relatives. And the UN reported these mass graves included women and children, with many reportedly showing signs of torture, summary executions, and potential instances of people being buried alive. The Israeli forces have denied all culpability. Next slide. So when we look at pregnant women, there are about 5,500 births per month. Most of these women have had no prenatal care, and many are internally displaced and do not know where they're going to deliver. So there are about 183 women a day giving birth without adequate care. There are reports of women undergoing cesareans without painkillers. If women risk their lives to get to the hospital, they're competing with all the injured people, and they're often delivering on the floor and discharged within hours because there's no space for them. And then they're discharged to a tent or a rubble. So women are giving birth in shelters, in their homes, in the streets, in homes with 40 other relatives. And the sanitation is terrible, and the risk of infection and medical complications is on the rise. And I should also add, they have no hygiene products. Next slide. And as you can imagine, this lack of food and clean water, the ongoing starvation and dehydration has a tremendous impact not only on pregnant women, but on breastfeeding women and babies. It affects bonding. It affects their ability to breastfeed. So we're expecting to, when we get the numbers, to see increases in maternal deaths. And we also need to remember that there are a lot of babies being born in these settings that are never registered. So we may never know how many unregistered births there were and how many deaths there were. There's been a huge psychological toll, which has an impact on reproductive health. And it's been reported there's a 300% rise in stress-induced miscarriages and congenital abnormalities, stillbirths, and premature births. So this will have a multi-generational impact. Next slide. Women and girls, as we know, are especially vulnerable. So with this lack of healthcare and hygiene and safe spaces and education, they are vulnerable to all the negative outcomes that we know, not only death, but postpartum depression, sexually transmitted diseases, UTIs, gender-based violence, and then diseases that are related to lack of water and hygiene and limited control over reproductive choices. The last that I could find on where people could deliver was on the 11th. There were 4 remaining maternity hospitals and 1 40-foot mobile maternity unit. Next slide. So I want to talk about the crime of genocide. This conversation is happening in the International Court of Justice, which is a part of the UN. So in January, South Africa issued a complaint against Israel of a pattern of genocidal intent. And genocide was defined in the 1948 Convention on the Prevention and Punishment of the Crime of Genocide. So genocide is defined as specified acts committed with the intent to destroy a national, ethnical, race, or religious group, and includes killing members of the group and deliberately inflicting on the group conditions of life calculated to bring about its physical destruction, in whole or in part. So South Africa was joined by Ireland. Nicaragua accused Germany of facilitating genocide by funding the military. Egypt joined South Africa. And then the International Court imposed new provisional measures and ordered Israel to ensure entry of food and to stop the spread of famine. Next slide. So the interesting thing about the ICJ decision in January was that they said South Africa has standing, that this could be a genocide, that Palestinians are a protected group. They reviewed the conditions in Gaza, which, as you can see, are unbelievably horrific. They reviewed the dehumanizing language coming from Israeli ministers, talking about the Gazan Nakba and calling Gazans animals, so showing genocidal intent. And they said Israel has to stop this and prevent genocidal acts and increase aid, report back in a month, and that Hamas has to release the hostages. Next slide. So the last few months, there have been multiple calls for a ceasefire, hostage release. Various UN agencies like the Security Council called this. The UN Human Rights Council said they thought that there was a genocide. The UN Special Rapporteur on Human Rights said there was a genocide and the country should impose sanctions on Israel. Netanyahu called some news of a possible International Criminal Court arrest as, quote, an anti-Semitic hate crime. And then the court pushed back at him that he was undermining the impartiality of the courts. In response to all of this, Biden halted some weapon supplies over fears of a Rafah invasion, but then arranged for $1 billion of other military aid to come in. South Africa, again, for the 3rd time, asked the court to take some action. And meanwhile, we've had massive protests in cities and colleges internationally. And the latest news is that the International Criminal Court is seeking an arrest warrant for Israeli and Hamas leaders. So we are in uncharted, unprecedented territory. This is today's globe. So when we look at the future, the London School of Hygiene and Tropical Medicine, and joined together with Johns Hopkins, made some predictions further into the war. They said if this goes on for 6 months without epidemics, there will be 6,500 excess deaths if there is a ceasefire. So people would die from their wounds and from infectious disease, mostly. If nothing changed, then it would be 58,000 deaths. And if there was an escalation, it would go to 74,000. And if there were epidemics, which are highly likely, all these numbers bump up with an escalation and epidemics to 85,750 people. And they predicted that 22% more children under 6 would be severely malnourished. They also noted that the medical schools and staff were targeted, so there was going to be a tremendous lack of training capacity. So the questions we need to ask is, what is the endpoint for this war? Will UNRWA survive? Are Israeli forces going to continue occupying Gaza, and how will that impact Gaza? Will there be a return of Jewish settlers? Will Gazans be able to return to the north? And if they do return, what are they returning to? Will they all be displaced into Egypt, Sinai, and beyond? And who's going to pay for the rebuilding? The other issues are, what's the future of Hamas? It's a political movement. Most experts feel there's no way to defeat Hamas the way Netanyahu's talking. What's going to happen to the Palestinian Authority? The cabinet resigned and the prime minister. We don't know what direction they're going in. And what will be the role of Arab countries? Next slide. So if we look to future health interventions, and we just talk medically, they need dedicated, secure supplies for everything that they need. They have to have resources to rehabilitate all of the facilities and infrastructure repair. They need recruitment of personnel and equipment, a tremendous mobilization of international aid, financial assistance, medical supplies, expertise, enhancing capacity, targeting education programs for the individuals that need to manage their chronic illness, and then addressing the massive physical and mental health needs. Next slide. If we look sociopolitically, because we know healthcare occurs in a sociopolitical context, I would say what we're seeing is a tremendous amount of structural racism, apartheid, cross-generational trauma, and revenge. We see Israeli reliance on military solutions to political problems with what appears to be a complete disregard for the health and lives of Palestinian people. And this is in the context of international law, which is that the occupying power, Israel, is actually responsible for the health and well-being of the people it occupies. And if we look at the crux of the problem, it's estimated that more than 5.3% of Gazans are dead or injured. And if this was the United States, the number proportionally would be 18 million people. So what I think is that the status quo can only continue if we as human beings see Jews as more human, more deserving, more innocent and honorable than Palestinian Arabs. If we as a community are blind to Arab suffering and the history of settler colonialism. So the fundamental issue does come down to racism, which potentially leads to ethnic cleansing and genocide. So in conclusion, what I would say is that Hamas war crimes do not justify an Israeli genocide, that we are seeing racism and revenge, violations of international law, tremendous amount of collective punishment, which is falling primarily on women and children, multi-generational trauma, ethnic cleansing, genocide, and that the health of Palestinians is obviously intrinsically linked to the liberation and the end of the siege. But in the immediate moment, what they need is a ceasefire, massive humanitarian aid, a release of the hostages, and it's very important to address the root causes and hold the countries that make this possible accountable, and to end military solutions to political problems. So as professionals, I would say one of the things that I think is most shameful is that professional organizations have not said anything. In Ukraine, they were very quick to speak out. I could see, for instance, ACOG doesn't have to say anything about Zionism or Israel or anything, but they could say that this level of deaths of women and children and impacting obstetrical practices is unacceptable. Nothing has happened except for the American Public Health Association. There are also groups like Healthcare Workers for Palestine and Doctors for Genocide that are doing active work in this area. I work with Jewish Voice for Peace Health Advisory Council, and we have a weekly report, and we do lots of webinars, and I also have a tremendous amount of information on my website. And then, as you can see on the right, there are a host of organizations that are doing incredible work. Right now, not much is happening because it's very hard to get into the region. Thank you very much, and I need to figure out how to not share my slide. So I think we can move to the next place. I don't see a thing that says I can stop sharing, so I don't know how to get out of the thing.
I was sharing the slides, so you should, if you just minimize your slides, you should be able to see.
Well, let's see if I can do that. Why don't you go on to questions, and I will struggle with my technique.
I will go on to questions. Thank you so much, Alice. It was a lot of information and quite overwhelming. And I think the first several questions actually relate to what you ended with. It relates to what we can do as clinicians, as health professionals. So somebody asked, what can Harvard do to help? Somebody asked, what can we do to educate the public and help alleviate this? And there is a cardiologist who is leaving Boston and going to Palestine, Israel in September, wondering, should I take medications? Should I take supplies? Can I do anything other than just bearing witness?
Right. I think that's an excellent question, and that because we are medical personnel, we are in a unique position to state what is going on with some kind of credibility. We should add that, for instance, the institution of Harvard was not eager to hear this information. So we have a lot of work to do with our own institutions and our professional organizations. But I think people do listen to doctors and medical professionals who speak out and describe medically what's going on as a way to enter into this conversation. In terms of aid, it's really going to depend on what the situation is. I mean, right now, nothing is going in and nothing is coming out. So everything is at a standstill. There are groups, like Med Global and Doctors Without Borders and groups like that do bring in health workers for a week or two to do emergency work. And some people find that very meaningful and will do that. But you have to be prepared for a very hard, dangerous, exhausting, and psychologically totally overwhelming experience. I've talked to many people who've done this. I think it is important to remember that we need to have a political voice to get a ceasefire and to get massive humanitarian aid in. And, it's the old thing. You've got to contact your elected officials. You've got to go to protests. You've got to wear your white coat. You've got to write letters to the editor or be active on social media. You've got to do all of those things. And, the climate is changing. The entire world is paying attention. Netanyahu is being accused of war crimes. I mean, this is it's a different place than we were in October, but it's a catastrophe right now. And I think it's very important not to sort of say this is just too overwhelming and I can't deal with it. I would suggest people look at the organizations that I mentioned, and then see if you want to raise funds for the organizations that are working in country when they can.
Thanks, Alice. We still can't see you, so I don't want to overwhelm you with fiddling with the camera, but if there's any way to turn it back on, that would be great.
I can't make it go back on, so I've officially given up.
Can you remember what you look like? I'm going to unmute Louise Ivers, who had a couple of questions. Go ahead, Louise.
Thank you so much. Thank you so much for issues. I was wondering if you could speak to the international systems and structures that are supposed to protect civilians and are supposed to protect people and are clearly failing. And how should we lose all hope in those systems? What do we need new systems? I'd love to hear your thoughts on that. And thank you so much.
So I could hear every other word. Could you repeat it?
Let me try, because she kind of typed this in, if that's okay, Louise. She's saying, what are the systems that will are supposed to protect children? And could you comment on whether we should just give up on these international systems because they're not doing their job? It's hard to have faith in them and in UN agencies, et cetera.
Right. Well, I think this is a very important question, because if countries flaunt international law and standards of medical neutrality and all the things that are important, it raises the question of whether we need to figure out a way to punish the country that's flaunting it, or we need to figure out a new set of world order. I mean, after World War I and World War II, there was a real attempt to say, look, we have to have an international understanding about how you make war. And clearly that international understanding isn't working. And so I think this is, I don't have an easy answer to this, but this is a conversation that needs to be happening amongst the lawyers and the people who do that kind of work. But I think what we have to do is not give up on the patients, who are the ones who are suffering and who are desperately in need of care. And so we need to figure out, how do we raise our voices to point to that? Because they are the ones that are paying the price for countries flaunting, rules of war or that kind of stuff. But it's happening in other places besides Gaza, obviously.
Thanks, Alice. There are lots of thank yous and appreciation for a very enlightening talk and a courageous talk. There's one question that is related to whether you were prevented from speaking in person at the Brigham. We have had multiple changes and cancellations related to this talk. Mostly the reasons given were logistics. So that's what we know. I won't speak any further about this, but we really appreciate the fact that we could do this today. We really appreciate the attendance of everybody. And we hope this was informative. And since it's recorded, it will be up on alicerothchild.com soon.
And I should also say that on this, I'm on a book tour, and I went to Dartmouth to Geisel Medical School, and I was not canceled, but I was postponed indefinitely. So we also we were able to find another venue. So I think that universities are administrators and powers that be are very threatened by these kinds of conversations, and they're worried about their donors and their alumni, and they're worried about being called in front of Congress and, being grilled in some McCarthy-esque kind of kangaroo court situation. And so people are scared. And I think this is a time that we need to be brave, and we need to be principled, and we need to remember why we went to medical school and why we do this work.
Yeah, absolutely. I mean, unlike in other areas as medical professions, we have a responsibility. We swore an oath, and we have a responsibility. And I think you're living it. You're living the oath, and we have so much appreciation for the work you do and for sharing what you know. Thank you.
So, anybody else?
More thank yous, but that's it. All right. Thank you, Alice. Thanks,
Well,
everyone.
thank you. Thank you so much. Sorry for the technological craziness, but it's the world we live in.
It worked out. Thanks.
Okay, take care, everybody.